Well, welcome to another edition of Suzy's Las Vegas. With me today, I have a very, very special guest. His name is Jack London. He's going to tell you his story. And believe me, this is a show you don't want to miss, and you're going to want to thumbtack it on your YouTube channel and all the rest of them, because this is the most important show you're going to see this year. So again, hi, Jack. How are you?
I'm just wonderful.
Yeah.
Thanks, Suzy, for having me.
Yeah, welcome to the show.
Thank you.
But you have a story. I mean, folks, I just went through this, and Jack is going to talk to you about what really happens in the hospitals and out there.
Healthcare. Well, we're all affected by healthcare, right?
Oh my goodness!
You know,
yes.
every time I have a chance to talk about healthcare, I ask people, how many people here have been affected by healthcare, and all the hands go up, right?
Well, sure.
Whether it's a family member or it's yourself or whatever.
Right.
The other part is I ask, how many people have had somebody that has reached out to them who is caring, that's wanting to know, and no hands go up?
Right.
Well,
Yeah.
that's the hole that we filled with
Yeah.
Patient Pal.
Yeah.
And Patient Pal is an advocacy. We're the concierge of medicine. And when you go to out of town, for example, and you go to a wonderful hotel, and you bring your spouse, and you're saying, I don't know anything about this city. Where do I go? Well, you go to the concierge, right?
That's right.
And the concierge basically will say, well, what kind of food would you like? I'll make your reservations. We'll go through that process. Well, put that in the hands of healthcare. That's what we do with Patient Pal. So we're the concierge of medicine. People will call, Suzy, every call, when they call us, says, I don't know if you can help, but. That's how it starts, all the time.
I wish I would
right?
have met you before this. Honest to God, Jack. Listen closely, folks, because this is really important.
And my background is a former hospital administrator, and I would visit the patients in my hospital, those that
Yeah.
were ambulatory. I'd say, how's it going? She says, I love the nurses here, I love the doctors here, but I have a problem. So what's that? I've got a problem with my insurance. I can't talk to anybody. I just dial 14, dial 2, it goes into some abyss, and I never get a call back.
That's right.
Well, I realized that there was a vacant hole in that arena.
Sure.
There wasn't anybody that was really advocating, not trying to sell them anything, not trying to sell them insurance, but to say, I'm paying for my insurance.
Right.
My employer is paying for this wonderful benefit.
Right.
How do I get it done the right way?
Right.
And that's where Patient Pal comes into play. With all my heart, I can say this. Everybody needs a Patient Pal.
Oh, yeah.
When you're talking about, well, even in any kind of scenario of advocacy, it's needed because you need to have the experts who understand. And we have, in fact, one of our marketing sheets is who to call, when to call, where to call.
There you go.
Right? Isn't that it?
Yes.
And you're kind of throwing darts when you're by yourself.
Yep.
Because you never know, where should I go here? Or is that a good doctor? Or is that where I should be in this hospital? And how long am I going to be here? Nobody gives you a direct answer.
No.
Right?
They don't.
And when my frustration many times, I'll see patients who have been in the hospital, they've done a battery of tests, and they say, what did they tell you? They don't know.
Yeah.
They don't know they're going to do more tests. They haven't really come up with something. We've experienced that in our own family,
Yeah.
where we'll have situations and circumstances that, wait a minute, you're going to give my wife a prescription, and then they're going to say, take this prescription and come back and see me in a couple of weeks.
That's what they do.
Right?
That's exactly what they do. They did that to my brother.
Yeah, well, and unfortunately,
Yeah.
they don't even touch you.
No.
Right? They
No.
don't, and there are times now where they don't even look up after they're on the pad or the computer
Yeah.
or the tablet.
That's
they're
it.
looking at, they're writing down. So, okay, Suzy, so tell me how you're feeling. Well, doctor, I'm not feeling very well. Okay, well, what are the symptoms? Well, if I needed to tell you, why are you telling me what I'm
And they
trying to
don't
get an
listen.
answer for? That's
Yeah,
right.
they don't
I want to
listen.
get an answer.
Yes.
Look, healthcare is a business. We know
Yes.
that.
Yes, it is.
Right?
It's
It's a big
absolutely a
business.
business.
That's right. But and to the credit of the doctors, I must say that there
Yeah.
are many, many, many that have compassion.
That's right.
They're few and far between.
You're right.
Unfortunately, but and part of it is because they become so frustrated with their own system. Because
Absolutely.
I had one of my very dearest of friends is a cardiovascular thoracic doctor. I will tell you, I've seen this doctor sleep at the bedside of his patient, waiting for them to come out of anesthesia to make sure he
wow.
was all right. He literally would draw after every procedure. He would draw the heart, and then he'd show you what he did, because he wants to put that in his own notes. That was his
Sure.
idea of recollection.
Well, that's great.
Well, he called me one day and he said, I don't know if I can continue to do this. I said, why that? He said, there's a guy in my house right now. He's laying the floor. We're putting a new floor in. He's making more money than I am. And here's a guy that's gone to school for, 15 years
Right.
to become a cardiovascular thoracic. I mean, you think about regular medicine, ongoing.
Exactly.
And I know that
Yeah.
it wasn't that he was about money.
No.
It was about the fact that here's a skill.
Yeah.
He's gifted.
Yeah.
And he had that opportunity to be able to take care of people.
Right.
And yet he was frustrated because everybody should be paid accordingly,
That's right.
And yet the way that our system is working,
It's
you
not.
hear the billions and billions of dollars
Right.
that the large health plans are making.
Right.
Well, they're not making that on their good looks. Let me
Yes.
tell you something.
We need to talk
Right?
about that too.
Well,
I want to open
well,
up
the cost of medicine. Well, the cost of medicine is all relative.
Yeah.
You know, we don't know. It has varied over the years, of course, and it continues to escalate. Right.
Correct.
There's no watchdog, if you will. Now, I'm not advocating healthcare for all and some of the other things that they've talked about, because I don't want the government involved in my healthcare, right?
Right.
If you're on of Medicare age and you have that's a sponsored program. And I don't know if I'm going to tell you something that probably your viewers don't
Yeah.
know.
I want to hear it.
By
I want to hear it all. They do
2030,
too.
by 2030, the government, this is the Center for Medicaid or Medicare Services, CMS is what it's called.
Okay.
They want to have everybody who is on Medicare in what is known as a Medicare Advantage program. Okay? By 2030. And that's not too far away, right?
Oh, my God.
And here's the thing. If those of you who participated in that, if you have Medicare Part A and Part B, then you also have the Part D. When you
Right,
have
for
that
the
certificate.
drugs, yeah,
Well,
and
you have a
pills.
choice to go where you wish to go, right?
Correct. Yes.
When you're in a Medicare Advantage program,
No.
no choices.
Nope.
Now, you may surrender the cost. You think that you're giving up something, and you are. You're giving up choice, is what you're giving.
Of course
right?
you are.
Now, there's a trade-off. If something, there's no free lunch. Right?
Oh, no. We
Okay.
already know there's no free lunch.
So when you're giving up that choice and that opportunity, you're told where to go, when to go, and how to go.
Correct.
Period.
Correct.
And so that's part of the downside of these Medicare Advantage programs.
You're exactly
Now,
right.
They're managing money.
Right.
Now, I want you to think about this.
Exactly.
All right, here's some startling, maybe these statistics will surprise you. Each one of those Medicare recipients, in return for surrendering to a Medicare Advantage program, the Medicare Advantage program, now, let me preface a couple of things first
Right.
off, because I'm going to say some startling things.
Well, I want you to.
I don't want to diss a Medicare Advantage program. They're good doctors. There's a lot of people that are involved in these programs
Right.
that they mean well. They want to take care of the people,
Yes,
right?
but-
there are the few bad apples in
Correct.
that situation.
Yes, exactly.
If you are a Medicare Advantage program a member,
Okay.
you have taken and surrendered your Medicare card to this company. So you're no longer
You're exactly
typical
right.
Medicare coverage, okay?
You're right.
It's surrendered. Now, in return, Medicare is basically passing the risk of your care cost to this company. It's a private
Yes,
company, right?
That's very true.
All right. $950 per month is the average that they're giving this Medicare Advantage program. You've experienced costs in the hospital, have you not?
Oh,
You've
my
experienced
goodness,
costs.
yes.
You know how far $950 goes?
What, a third of a day, maybe. That's
Yeah,
it.
not even
Not
there.
even a third.
Right. So
Try
so
ICU,
if,
that's another
if
story.
that patient becomes sick, God forbid,
Yeah.
the company that has now accepted that risk is on the hook
That's
for your
right.
cost.
That's
all right.
right.
So think about this. They want to keep people out of the hospital at all costs.
You're right.
Right?
You're exactly
because
right.
it's going to cost them, the company, a lot of money.
Mm-hmm.
So they want what I believe, a better medically managed patient. That's why I talk about patient Pell so much.
Yes.
An educated patient will fare better because they understand what their malady is, whether it's diabetes or chronic heart failure
Yes.
or arthritis or all the different issues.
Yes.
But they'll know how to better manage themselves in addition to with their health care providers if they're educated.
Exactly.
A typical member, your audience,
Yes.
is
Our
all
age.
the challenge
Yes.
of healthcare, right?
Correct. That's all the
And,
challenge.
and yet I don't want to insult them, but they are basically uneducated consumers.
Well, of course, I was.
Well, then we
I
are.
thought I knew what was going on
Yeah.
until this happened with my brother.
And Suzy, unfortunately, it's for everybody. It's like that.
Oh, my God.
And we kind of, and I know this sounds terse, but we kind of go brain dead when it happens with
Yeah.
us, right? Because it's like, oh, I don't know what to do.
Yeah.
I don't know where to go, who
Yeah.
to call,
Yeah.
what, right?
Yeah.
So that's where we want to be able to say, look, we're not going to wave some magic wand and say it's all going to go away. We at least know that we're going to treat a patient like family.
That's right.
As my nurses will say to you, what can we do for you, Suzy? How can we help you? Let's talk about a couple of things. So we do basically what we call an intake to be able to understand what you're challenged with.
Okay.
All right? Then we say the question, who are you covered by? Well, I have this Medicare plan, or I'm on this ABC network of services. I work for Joe's Bar and Grill, and he's given me this great plan.
Yeah.
Okay?
Exactly.
Well, what we want to do is take that plan and supercharge it.
Oh, that's
We
wonderful.
want to be able to say, let's connect the dots here. We know the doctors that's in your plan because we have them listed. We know what your benefits are because we know you have copayments, you have deductibles, you have all
Right.
these things. You know, we part of the challenge with Obamacare, and again, I know I'm pressing some buttons here, but
That's fine.
Okay,
We need to
I
talk.
will just tell you.
Seriously, Jack, we do.
Obamacare and something similar to it, the average copayment and deductible is $6,000. Now, if you were to go into the emergency room for you've got something going on and you don't know, what do they first do? They'll do an MRI, they'll do a CAT scan, they'll do blood work, they'll do everything because they're practicing defensive medicine. They don't want to get sued.
No.
So they think in terms of, okay, if I have to go on the witness stand, did I do everything I was supposed to do? All right. Well, what does that mean? That means that the cost kind of escalates, right?
Correct.
So now it's up to $3,000 for a typical emergency room that you've waited 11 hours to get into.
Right.
Because you weren't bleeding profusely.
Right.
And now all of a sudden you're in the back there. Now they're going to do a whole battery of tests, right? You leave, you've got a $3,000 bill and a $6,000 deductible. Who do you think is going to pay for that?
That's right.
Well, that's your bill,
right.
You may
You're in
have
charge.
insurance, but it's not going to cover that.
No.
Because now you have that deductible that you have to make.
Right.
That's been my rub. And part of what has happened is it has caused hospitals throughout the country to close their emergency rooms.
I believe it.
You will see, and particularly rural hospitals who are very needed. I believe they serve the purpose in these smaller communities by all
Right.
means. They're the largest employer usually,
Right.
and they're the ones that people go to and gravitate toward.
Yeah.
A lot of people who, for example, want to retire, one of the things that they first want to know is, what kind of health care am I going to go for? What do I have? Where
Right.
am I at?
You don't realize until you get sick. Ask me. And then you say, oh my
goodness.
God.
Yeah, you don't know what to do. No, know what to do. Well, we're seeing that in so many different
Yes.
instances, and that's why what we're hoping to do is fill that void, to be able to
Yes.
better educate a member, to have them have the ability to say, my goodness, now I understand what healthcare is all about.
Right.
At least they understand the fact that, and again, we're not going to change necessarily their financial arrangement, but I will tell you this, a better educated consumer who is a better patient
True.
is less cost,
That's right.
right? Because they're not going to use up all of the stuff out there
No.
by just saying, well, maybe I should go here, maybe I should go there, maybe I should go there. You have to be able to realize, there's a direct primary care is concierge medicine. And for your viewers, once again, and listeners, direct primary care is a primary care doctor that basically is opted out of the system. Because they're saying, look, I'm not making it on the 30
No.
cents on the dollar that
Correct.
these health plans are paying me. So if you give me $130 or $150 a month or whatever, I'll give you my cell phone. I'll be at your call.
That's what my husband and I have.
Right? And
Exactly.
then you go.
Steve and I have
guess
that.
what? When you call your doctor,
answer.
They answer.
Yeah.
And they'll say, Suzy, when do you need to come in? Come on in.
Yeah. Yeah.
Not 3 months down the road
No,
or whatever.
no.
They'll take care of you.
Correct.
And that's, to me, that's why it's called concierge medicine.
Correct.
But it's also primary care. I believe that the primary care doctor is the captain of the ship.
Oh, my goodness, yes.
A lot of people think, well, I've got to go to this specialist or this, but you know what? You got to
He's
find
the first guy.
You need to find somebody who
Yeah.
wants to say, Suzy, we're going to find out what's going on.
Right.
I don't want you to just end up in that cardiologist's
No.
office, and that's
No.
going to be $350 on your. And again, I predicate a lot of these comments on money, right?
Right. Well, most of it is,
unfortunately,
Jack. I hate
it's-
to tell you.
Well, yes, it's
Yeah.
business. It is business.
And a lot of people don't have that, and then they're hit with all these bills, and they're trying to swim and they're sinking.
Well, the unfortunate aspect is the fact they don't know what that bill looks like.
No.
I remember my dad got
No.
a bill, and he was on Medicare, and he had heart surgery, he had some things. The bill was like $75,000, but Pop was on Medicare A and B and all that stuff. I said, Dad, that's not your bill. He said, it's got my name on it. I said, yeah, but that's just what is known as an explanation of benefits, an EOB.
That's
they
it.
just want to tell you where your money's going.
Right.
It's being paid by the hospital, to the hospital, on your behalf because you have coverage and you had a supplemental policy.
Right.
And that's really important for your listeners and viewers.
Please listen. Say this one more
Supplemental
time.
policy is so important because that'll pick up that difference of that 20%. That'll pick
Right.
up the differences. And your agent or your representative will be able to say, you know what's best for you? You live in this particular area. They have a number of different great opportunities, and here's a great supplemental policy for you. And shop it around.
Oh, yeah.
Everything. We have a sign in our offices. Everything's negotiable.
Right. Yeah. Yeah.
And as a result of that,
Exactly.
the cost of medicine's negotiable.
Well, sure it is.
Yes, it is.
But Jack, it's a funny thing. When you go in there, you think that when you take your cards out and you give them to the doctor, you give them to the hospital, that things are going to get better.
Oh.
Not necessarily.
It's not a
That's
cre-
why we're doing a show
Well,
today.
not only that, it's not a credit card.
No,
Okay.
heavens no. If
I have
they
insurance.
want your credit
Oh,
card,
that doesn't-
yes.
Yeah, they want your credit card.
Absolutely,
And now
that's
they're
number
asking,
one.
And now most of them are asking for the 20% or deductible up front.
Upfront. Yep. upfront.
Because they've had such a hard time collecting it.
Right.
That's part of the biggest debt in all hospitals, the patient's liability. Because, and if you, I know this very well as a hospital guy, one of the things that we realized was at the end of the day, there is a payor. Somewhere's going to pay it, right? Well, if it's a sponsored health plan.
Right.
Well, I'm not going to go after the sponsor because they're not going to listen to me. I'm going to go after the patient.
That's right.
Because they're going to scream and go down to their HR department or whatever and say, hey, I didn't get paid, and they're coming after me, and we got to get this paid. So now the machine gets into process.
Correct.
I am of the belief that the capitalism, if you will, of healthcare is absolutely needed because capitalism breeds challenge of competition, right?
Yeah.
If we were under a situation where you have universal health care and you have it all the same, we get so many calls from patients who live in Canada, for example, or in other areas that have universal health, that they can't get in because it's not an emergency. And it's 6 months out or 8 months out. So
Right.
they'll come to the United States to get health care.
Right.
Because they don't want to live with this hernia because it's life-threatening.
Correct.
It's that they don't have enough room in the schedule in order to get them in properly.
Right.
Okay?
Or they don't want to die. That's
and
the other
that's
thing.
it. They want to
I'm
be able
gonna
to have a
say it.
better
They don't
quality of
wanna
life.
die.
It's a better quality of life.
Of course it is.
So we want to be
Jack.
able to be that conduit to that opportunity and helping people with that.
Oh, I agree. I really do. But how many years ago did you start this?
28 years ago.
Wow.
Yeah.
You've learned a lot along the way, haven't you?
I was still learning.
Every day.
Every day.
Yeah.
Every day, Suzy.
Yeah.
Every day things change.
Yeah.
Pharmaceuticals. Well,
Yes.
here's a perception. Next time you are on television,
Right.
watch who are the commercials. Where are the commercials? It's
Yeah.
this drug, it's that drug. But here's the
Yeah,
interesting thing.
that's right.
They never tell you what it does.
No.
here are the side effects.
Yeah.
But it never tells you what it does, because
No.
they can't say that it's going to heal this and heal this and heal this and heal
No.
this. But it is, well, just like the people have used these diabetes drugs for weight loss drugs.
Yeah, that's the latest
Right,
thing,
and they don't
isn't
even
it?
have they don't even have diabetes, but they're using them for weight loss
Yeah.
because they think that that's the answer to all
Well,
answers to
doesn't
all
it
answers.
kill people that way too?
Of course,
I was
absolutely.
gonna
Well,
We're not supposed to say that.
I just what I'm saying is that the pharmaceuticals have made an incredible amount of money. A lot of people
Right.
don't know the process. When you develop a new drug,
Right.
it becomes a proprietary drug, and it's non-generic. So it is basically a name brand drug.
Full amount.
Full amount.
Yeah.
Okay?
Yep.
If you attempt to get a generic, you can't, because they have a window of opportunity of about 7 years. Okay? Once that 7 years, that is when that is open now. They basically have all of these clones of stuff.
Right.
Well, if you also are creative enough in your health plan,
Yeah.
most of the health plans will give to their members generic drugs for nothing, because it costs them pennies.
Right.
But it helps the difference. If you're not on your blood pressure medicine and
Right.
you're supposed to be taking your blood pressure, there's plenty of generics out there to
Yeah.
take your blood pressure medicine,
Right.
and it'll cost you pennies.
Yeah.
Pennies. So
Yeah.
do it. The other part is that find yourself a doctor that you can trust and to be able to talk to about all of your circumstances, but they'll also do the proper blood work. They'll go through that.
Right.
Take that yearly physical. Take those things. And I'm being proactive. I'm talking about people that are sitting back and saying, well, if I get sick, I'll just go to the emergency room. Wrong. No.
Wrong answer.
Costs you too much money.
Oh, yeah.
Why do you think between the urgent cares and the emergency rooms, we have all these people? Because especially if you look at the demographics, the younger the demographic, the more infallible they think they are. I don't need that. I don't
Right.
need that. I don't need that. Well, that costs a lot of money.
Sure it does.
So if you're going to go into those particular avenues of circumstance, find yourself a good primary care doctor. Be able to have a relationship with that primary care doctor. If you have a good insurance, they all encourage primary care utilization. And most of the time, it's little or no out of pocket to you. So take advantage of that opportunity, just for your own good and your health care.
Right.
That's what's important. And the complexities of it all, Suzy, doesn't go away.
No. I mean, it's really interesting, Jack. I mean, it's like opening up a can of worms, when you start.
I'm sorry. I know.
No, I'm glad you did, because you and I talked after this happened. My brother ended up with, he had a couple strokes, and then he ended up in the hospital. While he's in the hospital, he got dropped in the hospital, and he had a wide mouth aneurysm.
Oh.
Then they did the surgery. Then everybody's telling me that he's going to die. This went on for 2 months of my life. That's why you haven't seen the show. But I'm finally back, and talking. And I really wanted to talk to Jack about this, because I was novice like everybody else. I didn't believe that this could really happen. And the kicker with me was, he's in the hospital, and they do the surgeries and all that, and he's for 3 weeks, he's not waking up, and they kept telling me he's going to die, he's going to die, he's going to die. And they kept taking him down because he was having vasospasms too. So 5 more times. So he's into the operating room 6 times.
Wow.
And then they want to put a feeding tube in him. They're going to put a feeding tube. They have a catheter, and what the hell's the other thing? The diaper, the whole bit. Then they want to stick him in because he had our Medicare Advantage type deal insurance. They wanted, after they do this and they put a feeding tube in you, the next thing I get, because I'm his, power of attorney and the whole bit, they give me a discharge notice. And I said, "Are you crazy?"
Yeah, where's he going to go?
And they said, "Well, we need to either put him in hospice, or we need to put him in a home, and let him die there, basically." Then
Yeah.
they gave me a list of homes. Oh my God, I wouldn't put a dog I didn't like in there,
Yeah.
So I had to be proactive. So I'm telling you, I'm cutting through the chase here. Talk to Jack. He knows all the answers in Patient Pal,
Yeah.
because what I did, I wouldn't wish that on anybody.
Yeah, nobody.
But we finally, after all this, he ended up in a good place. He had a beautiful place to go to because I got him off of Medicare Advantage, straight Medicare, and got things straightened out where I could get him into a great acute rehab facility.
Nice.
He came out on Sunday. We literally had a party for him. He's at my home right now.
Wow.
And he's able to walk and talk.
Look at that.
And
That's incredible.
But if I would have let this thing go, what we're trying to tell
he'd
you,
not be here,
he wouldn't
Suzy.
be here. He'd be
No.
dead.
Well, I applaud you for that, Suzy.
Yeah.
But there's very few Suzys out there.
I know.
And
That's why you
unfortunately,
need to talk to Jack.
It's confusing and
I
it's
know.
frustrating. And then you finally give up the ship and just say, I'm all
Yeah.
done with this stuff.
Yeah.
When COVID hit, which was horrific,
Yeah.
most of the deaths out of COVID were from loneliness. I
Were
believe.
they?
Well,
Really?
they were. If you were in a nursing home or that, and you
Yeah.
couldn't see you've seen pictures of people putting their hands on
Oh, yeah,
windows to try
yeah.
to have that. Well, there wasn't any personal contact.
No.
If you have the will to live was gone.
Yeah.
Right.
Yeah.
And people were saying, well, why should I? I'm not going to live in this room. I don't care about living.
No.
There's no reason for it.
No.
And they would die of a broken heart.
I believe
And
you.
unfortunately, that was a medical condition that they forgot about when they were talking about
Yes.
COVID and all this
Yes.
stuff. And that's a whole nother ball game right there. But I will tell you, there are opportunities for every type of modality of disease.
I believe you.
There are all over the country.
Right.
You'll see centers of excellence. You'll see different things. One of the things that Patient Pal does do is to be able to vet through, because we know the good, the bad, and the ugly.
Oh, I love
We
that.
know the best of the best.
Yeah.
And from 29 years of doing this, we've kept record of all those different outcomes in patients.
Exactly.
We would like to treat a patient, and they know this, as if it were family. And you know this, and you wanted the best for your brother.
Right.
God love you for doing what you did.
Yeah.
But as I said, there are not
There's
too many
not a lot-
Suzys
no.
out there. I know.
Most people would be like, they would believe this. This is the problem.
Well, if they would have said he was going to die, and you say, okay, fine. They'd say, oh my gosh, I'm going to miss him, but I don't know what to do.
Right.
Well, but you did
Yeah,
because
yeah.
you were diligent and you
Yeah.
took the extra step.
Yeah.
Most unfortunately, people don't because
No.
they get too frustrated.
Well,
through the
sure they
process.
do, and
Yeah.
they're brokenhearted and hope. And then the other thing with the ventilator,
Oh.
what is that? Is it he was on a ventilator for 21 days,
If you vent someone,
and they knock your tooth out, by the way, to put
Well,
the ventilator.
well,
on.
that's basically your artificial breathing.
Oh, yes.
Right? You're
Yeah.
no longer doing that.
No.
God forbid. My wife had an issue most recently with a tooth abscess.
Yeah.
And if you have a tooth abscess, get it fixed. By the way, don't
Yes.
sit and wait for that kind of
No.
stuff. Anyway, we found that as the swelling continued, and eventually she did get an IV drip in the hospital because we couldn't get her in at the time for the dentist within a time frame that we needed to be in. It was a weekend and so forth.
Right.
So I said, honey, we're going to the ER. We
Yeah.
did. Well, we met, by the grace of God, a great emergency room doctor.
Oh, that's great.
And he said, I am so glad you came because if you would have waited just another day, you would have been vented. This is
Yeah.
a woman with a
Listen to
tooth
what we're
abscess.
saying.
And that would have been disastrous.
Yes.
So anyway, again,
Yeah.
it's timing.
Oh, yeah.
It's about the expeditious opportunity to take advantage of who is out there that you know. If you don't know, call
Right.
us. We'll help
Right.
you. But for the most part, people are beholden to the system,
Yeah.
and the system ain't working.
No,
it's a broken.
it isn't.
Sorry about my language,
No.
but that's what's happening.
No, but you're right. I was so grateful when I talked to Rick, my producer, and Rick told me about Jack London. So I called him up right away, and I really and truly wanted to find out about this. I don't want anybody that I know or even don't know that watches the show, even cares, to have to go through what I went through.
No.
That's why Jack is on this program today.
Thank you.
And we're going to put all of his links and everything on there. He's perfect for you. If you have any questions at all, it doesn't hurt to ask. It doesn't cost you anything
right.
to ask.
Yeah.
But the big thing is ask before it's too late.
Indeed.
Yeah.
Many people, when they say, "What do you do?" I'll tell them, they'll say, "Where were you 2 weeks ago?"
That's right.
Doggone it! I wish I would have had somebody to talk to.
Yeah,
Yeah.
yeah. But you know what, Jack? The people that need to know this, we'll have it on our show, and I will put links and all that.
Thank
and I
you.
truly believe in you. I really do.
Thank
I
you.
looked at everything for Patient Pal, and I would highly recommend it.
I'm
Yeah,
honored. Thank
yeah.
you so much.
So
Suzy.
what else do you have to say before we say goodbye?
I'm just blessed to do what I get to do, one patient at a time. That's what we do.
When you come back to Las Vegas again, I'd love to have you back on the show.
And I will be right back here.
Okay,
All right.
awesome. Well, you heard it here first, so you be sure and like, subscribe, and share. And I'd like to put a personal note out there. If there's any of our viewers out there that have a story that they want to tell, I'm going to open up the door, and I would love to have you on my show. So you can call me at 702-540-9929. You can also click the link, subscribe to Suzy's Las Vegas, and it's very important what we talked about today. You won't believe how important it is. Hope you do this before something happens. Have a beautiful day. That's our show.